Namaskar. Today we will study the drugs with gastrointestinal side effects. And there are many drugs which are associated with constipation, diarrhea, vomiting, hyperacidity, ulcer. All these are the gastrointestinal side effects. In addition to them, we will also discuss pancreatitis, drugs which can cause inflammation of the pancreas, as the pancreas is the associated organ to digestive tract. So we will also discuss drugs producing pancreatitis. So there are many drugs whose side effect is constipation, and that includes these are some of the important drugs. Hematinics, including your iron salts, bismuth salts bismuth subcitrate, bismuth subsalicylate, tricyclic antidepressants like amitriptyline, imipramine, calcium channel blockers like verapamil, vinalkaloids like vinblastine, vincristine, antihistaminics like chlorpheniramine, antacids, your aluminum salts and calcium salts, aluminum hydroxide, calcium carbonate, ephedrine. All these drugs produce constipation. Similarly, there are certain drugs which are associated with diarrhea as a side effect. All the antibiotics, mostly with broad spectrum antibiotics like tetracycline, there will be diarrhea because the beneficial bacteria, the gastrointestinal microflora, are destroyed by these antibiotics, causing diarrhea. Then the cholinergic drugs which increase the gastrointestinal motility and can cause diarrhea. Similarly, digitalis glycosides, propranolol, neomycin, all these drugs can also cause diarrhea. Neomycin causes malabsorption syndrome, and because of that there will be diarrhea. Then there are certain drugs which produce vomiting, and nausea vomiting is the common side effect with almost all drugs. But anti-cancer drugs, they can damage the gastrointestinal epithelium, and because of that there will be vomiting with all the anti-cancer drugs. So that is the major side effect of anti-cancer drugs. This vomiting has to be controlled by use of drugs. So antiemetics have to be taken. So anti-cancer drugs like cisplatin, chlorambucil, bleomycin, vinblastine, methotrexate, this tamoxifen, this selective estrogen receptor modulator used in breast cancer, all these can cause emesis or vomiting. Then ulcer is another gastrointestinal side effect, and drugs like non-steroidal anti-inflammatory drugs and the glucocorticoids, they increase the risk of bleeding or perforation in the gastrointestinal mucosa and cause ulcer. Now, drugs which cause inflammation to pancreas, causing pancreatitis, immunosuppressants, sulfonamides, the loop diuretics like furosemide, ethacrynic acid, thiazide diuretics like chlorthiazide, the non-steroidal anti-inflammatory drugs sulindac, then H2 receptor blockers, cimetidine, and then methyl dopa. All these drugs are causing inflammation of the pancreas, that is pancreatitis. That's all. Thanks.